Hi, everyone, and welcome. My name is Dr. Jody Jacobson Fry. I'm the co-chair of the National Workplace Suicide Prevention Committee, along with Dr. Sally Spencer Thomas. Today's presentation is on an important topic. I'm excited to bring Andrew Dudash today to speak with us about suicide and mental health in the art, entertainment, and recreation industry. Andrew Dudash has served for over a decade in live entertainment in various roles and capacities as an international touring professional. Witnessing firsthand the negative psychological impact of touring, he's currently completing his Master's in Arts in Clinical Mental Health Counseling at the University of Northern Colorado, where he specializes in family grief and bereavement, suicide prevention through peer support programs, and research and efficacy of grief programs and interventions. His persistence and passion show in his work as an advocate and educator for mental health and support systems to live entertainment, labor unions, and touring professionals. We're very honored to have Andrew Dudash with us today to talk about this topic. Before I turn it over to Andrew, I just want to mention the collaborative partnership that supports the national guidelines for workplace suicide prevention. Our guidelines and initiative are supported by the American Foundation for Suicide Prevention and the United Suicide Survivors International. Our national guidelines for workplace suicide prevention are based on 8 guiding principles. We launched these guidelines in 2019, and you can see our 8 principles that run through all of our practices here on the screen. Additionally, we work to take a multidimensional, comprehensive approach to workplace suicide prevention. This includes 9 practices, which comprise our upstream, midstream, and downstream approaches to suicide prevention in the workplace. Today's presentation will actually touch on areas of all 3 levels of intervention. I'd like to now turn it over to Andrew for our presentation. Thank you for being here.
Thank you, Jody. Let's start with a simple exercise. Think of a time, possibly within the last year, that you attended a live sporting event, or watched a television show, or saw a movie at home, or maybe in the theaters. Maybe you attended a play, a comedy show, a symphony, orchestra, or live concert. Can you recall who you were with? Remember those special people in your life, whether it's family or friends, who brought you joy and made those moments unforgettable. Recall the delightful atmosphere surrounding you, or perhaps the enticing scents, flavors, and sensations that accompanied those cherished experiences. If you nodded along and hold precious memories like these, then you'll find the information I'm about to share quite meaningful and relevant to your life. Today, I want to bring attention to the alarming rise in workplace suicide among those involved in art, entertainment, and recreation. It is crucial that we acknowledge the need for more resources, interventions, and research to support mental illness in this industry. Both men and women working in art, entertainment, sports, media, and other related occupations are experiencing a significant increase in suicide rates. Specifically, musicians, singers, and related workers are among the top 3 occupations with the highest suicide rates in the country. However, it's important to recognize that it's not just the performers, but also the hardworking individuals behind the scenes, like the roadies, the riggers, and support staff who play an important role. I was one of them. Despite their dedication and long hours, they often go unrecognized. Unfortunately, they are often overlooked compared to their more high-profile figures like actors or musicians, simply because they are not in the spotlight. According to the CDC, this major industry has possessed some of the highest death rates by suicide for females historically, both in 2016 and in 2021. The previous collection of this data in 2016, death rates by suicide for males in art, entertainment, sports, and media was well below the national average. By 2021, that number grew to over 4 times the rate of 2016. Women in this group still have some of the highest suicide rates in the country when we look at different industries and occupations. And like I mentioned before, singers, musicians, and related work professionals are the top 3 when it comes to suicide rates with specific occupations. So if you've been working in art, entertainment, and recreation for a while, like me, and you know around 10 people who may have died, statistically speaking, at least one of them died by suicide. From my own experience, I can think of three. And that doesn't include the high profile performers such as Chris Cornell, Kurt Cobain, Hunter S. Thompson, or Robin Williams. As we are aware, many of the factors that contribute to suicide identified by the CDC include known risks such as low skilled or low transferable skill jobs, low educational attainment, low absolute and related socioeconomic status, job access to lethal means, job stress, and poor support by both supervisors and colleagues. From my own experience, specific to this field, some other contributing factors to the high occupational suicide rate in this industry may include extensive travel and isolation. So the lack of familiar interaction or coworker support, as you're often on a plane, on a bus, or in a hotel room with no one to talk to. Sleep deprivation, from not only the travel, but from working 14 to 16 hour to even 18 or 20-hour days. And this can influence the next factor of substance use and misuse. Substance use and misuse runs rampant, not only because of the constant social environment, but occur possibly for workers to stay awake, to get the job done, and to ensure sleep when they're able to finally rest. Not to mention any possible increased likelihoods of other mental illnesses due to sleep deprivation. Post-gig depression and income instability are also possible contributing factors to suicide, substance use, and other mental illnesses within these workers. Poor supervisor and colleague support is a significant factor, as many are experiencing their own mental health issues and not willing to create a culture to safely discuss them. As well, the countless managers who are often not qualified or have minimal, if any, training to manage the lives of others. And then the sheer physical exhaustion and the mental fatigue endured just to make sure that the show must go on. So by applying and retrofitting already existent resources that have been utilized to support other industries, such as our brothers and sisters in construction and extraction, as well as the airlines, we begin to bring about a positive impact that is necessary. Implementing national guidelines from the top down among the industry's largest shareholders and local union organizations, while creating community from the bottom up through communication and peer support models, addresses these growing rates in a two-pronged approach. From the top down, buy-in from leadership such as film studios, event promoters, talent buyers, managers, agencies, and artists is critical. Implementation of the HOPE certification commits organizations to these national guidelines, cultivating a caring culture and focusing on community and worker well-being, while committing organizational leadership to training implementation and building a stratified suicide prevention response program. Tools such as break cards and strategic monitoring and adjustment to individual worker hours can reduce job stress, burnout, fatigue, or injury. Break cards are a specific tool offered by labor unions for when a worker may have reached maximum exhaustion. The worker presents the card to their supervisor, and no questions asked, they can walk away from the show or job for the rest of the day. But these instances are often without supervisor follow-up, further employee resources, or mental health treatment options. As well, the promotion of and education to leadership and managers on mental health and crisis resources as tools to crisis response. When it comes to promoting mental health and crisis response among leaders, managers, and peers, communication is crucial. It's important to increase awareness, to educate workers about suicide and mental illness so they can be more comfortable interacting with individuals who may be experiencing suicidal thoughts. Peer support programs like mental health first aid provide workers with the necessary tools and skills to have conversations with colleagues who may be in crisis. And then promoting productive self-care and providing self-screening tools, among other interventions like stress inoculation, empowers workers. So what can we do to provide help to this workforce demographic now? Utilizing existing community resources and organizations is a great starting point for helping various workforce demographics. Mental health first aid, which I mentioned, which focuses on peer support, has proven effective at addressing coworker mental health and substance use and misuse. Additionally, mindfulness-based practices show promise in supporting touring professionals dealing with depression or anxiety. Organizations like Backline.care, behind the scenes, or technicians for change, all specialize in advocacy and mental health resources to live entertainment, the film industry, and the performing arts. By advocating and fostering awareness, we can build a community that includes the necessary resources for mental health care. But if immediate help is needed, then dial 988 for the suicide and crisis hotline. The rising suicide rate among art, entertainment, and recreation is important to all of us. Although I have discussed several opportunities for multiple levels of intervention, I do want to make note of one of the larger limitations to getting help to those working in this industry. Current state regulations for mental health can often serve as a barrier to care for individuals. This is not including other barriers such as cultural stigmas or socioeconomic status. These regulations limit the ability for touring professionals specifically to gain access to consistent care due to their extensive and sometimes rigorous travel schedules. Whether you've been affected by suicide through a personal relationship or not, awareness to this growing suicide rate among art, entertainment, and recreation, and activating the resources and interventions is the quickest way for us to provide support to those who need care now. Furthering research specific to this industry and occupational demographics can provide insights to not only the effective interventions, but have the potential to open further insight into other industries and worker demographics, including shift, gig, or seasonal workers, or more specifically, independent contractors. Not to mention the possibility of examination of causal factors to suicidal ideation, such as sleep deprivation and substance use. Like AC/DC said, it's a long way to the top if you want to rock and roll, but that doesn't have to be unsupported. Thank you.
Thank you so much, Andrew, for sharing information about this industry, one that maybe doesn't get as much attention as it should, as you pointed out. These are some resources and references for folks on the call today so that you can learn more about how to implement some of the strategies that Andrew mentioned. I just want to say thank you to everybody for joining us today, for taking time out of your schedule to learn about the risks and the opportunities for suicide prevention in the art and entertainment industry. I hope that everybody will take a moment to explore our website at www.workplacesuicideprevention.com to see our resources and to take the pledge to make suicide prevention a health and safety priority in your workplace. Thank you again for joining us.